on establishing referral systems from physicians to evidence-based programs. And it is very nice to be back. Hopefully you are all seeing my screen. And if that changes, please let me know. And also let me know if I'm not talking loudly enough. With me again is the wonderful Joni Saunders.
Hello.
Who is here to make sure that I don't mess up or lose us. So this time, what we want to talk about is referral systems and all the moving pieces and parts, and how do we do this so it helps you? How do we do this so that it helps practices and so that it helps ultimately the patient? So audio problems, and so if you have a glitch every once in a while in the audio, it should reconnect automatically, and hopefully that will be all it takes. So these are the webinar learning objectives, the overall version, and I won't bother to go through them again. What I will tell you is what we want to do today in terms of objectives is to look at some of the self-management support tools that you may already have in place, and then you can inform me of which ones you have, which ones you don't have. Again, these are selling points to working with the practice and making the connection. Also, the difference between a recommendation versus a referral and why we tend to favor one over the other. And then we also want to talk about the role you all can play, the health systems play, community-based organizations play in putting all of this work together. Does it all have to be on your plate? Hopefully not. And does it all have to be on the practice's plate? Hopefully not, because they won't do it. It's too much time for any one player. So, and then we're going to do another action plan, and because that's what we do. So I first want to hear from you guys on what you thought as we were taking a look at, as you had a chance to talk about and think about what we covered last time. I didn't receive homework from anybody, which I think is probably a good thing because it means you were all working hard. But I am wondering what it was you talked about internally in terms of what it is that you would like to see come out of this process, what bridges already exist, what additional connections and pieces and parts would you like to see in place, and how do you view LifeSpan's role in this work? So I'm going to turn it over to you guys for a few minutes, and please fill us in on what you've been thinking and what you've been up to.
Well, first of all, I think we missed the first part of what bridges already exist. We kind of went right to where do we see our role in new connections.
Okay.
You already
Well, but I don't know that there are a lot.
I don't think
bridges,
there are.
At least not that I'm really aware of. I mean, you know, we do have the triple A's that do some of that, but it's kind of I mean, there is a statewide organization, but I get the sense that there's not a ton of communication between the other ones in the state.
No.
So, I mean, other than some medical practices and some hospitals and maybe some practitioners being aware of this and taking some initial steps, that's about the extent that I'm aware of. Joyce, do you?
Yeah, I'm not seeing the connections. I think mostly what I'm seeing is the doctors are printing out the instructions, this is what you need to do, and this is where.
Right.
But I'm not seeing any like follow-up or connections with any kind of community organization.
Right. Now, you know, some of the mental health stuff is being done in this kind of format, but nothing that's, you know, really kind of focusing on medical, right?
Right.
Would you say? Okay.
So they're doing some group appointment sort of work or some more behavioral health, mental health group visits, but not necessarily something that would connect chronic disease or ongoing health conditions.
Right.
Okay.
And there's, you know, they've got some pretty decent models that they're piloting with the patient or the medical homes with the mental health illness, severely mentally disabled individuals, Medicare
Right.
So, which we're not really going to focus in on that. We were looking more towards the medical doctors.
And that's gone away. I mean, there's several health home pilot projects that have been started here to deal with mental health issues. But again, I think that's way out in front of anything that I've seen that's medically related.
Okay. And so what kind of connections then would you, it sounds like the bridges are yours to build, if I can be so bold. So what kind of connections would you like to see in place? What, if you could wave a magic wand and be 2 years down the road, what would you have going on that includes this work we're talking about?
Well, I can start because I started, obviously we want those relationships with those physician practices.
Okay.
I just went through the NCQA website to see who was already recognized as the patient-centered home, and pretty much like did a list of used all the zip codes in Butler County to start with, to see how many doctors and practices there are. And it actually narrowed down to, I think like 14, or maybe like 14 different practices, but there were 7 of them when you actually went down even further, because like there were 3 in different sites.
Right.
So I thought it's like at least I would start, those would be the folks that we would start with, maybe trying to make those connections and build the relationships.
Great. So then if things go well and you have relationships with all 14 of the practices and maybe some of the hospitals that are related to those practices, that would be a very good thing. And what do you think then, how do you see LifeSpan's role in this? So 2 years from now when we're waving the magic wand, are you viewing your role as the person who connects the dots? Are you viewing your role as the organization that is doing all of the classes, all of the connections? Are you seeing yourself as helping the practices to make referrals and to understand the self-management support, but not necessarily doing the classes? I mean, how is it you're seeing what LifeSpan's role would be in this?
I think it would be fun to be all 3 and be getting paid for it.
Okay, that's good. That's a good answer.
Is that Pollyanna? No.
Well, but I think that this kind of goes back to the second bullet point, and that would be that we'd like to make sure that we have clear evidence of the benefits of this, of what we've got here and why it makes sense, so that we can find a funding stream that we're not having to go back to the well every year, and that would provide some consistency, that the funding would be there every year and wouldn't have to be putting the program at risk every year because of funding. And I think that kind of ties together with what role.
Absolutely.
Right.
Absolutely. But am I understanding what you're saying correctly, in that no one, even though there's a statewide organization that's doing some classes in the community, that as far as you know, no one is really taking the lead in terms of playing this role of making the connections to the health system in your market, so that this is really kind of a wide open opportunity if the funding could be established.
From what I can tell you, yes.
I am a
Okay.
practitioner doing diabetic. I missed
that comment, I'm sorry.
I'm aware of one nurse practitioner